Hello and welcome to Students Supporting Mental Health and Wellness. My name is Cont. I'm a staff psychologist at the University Health Service.
Hi, my name is Junichi Shimaoka. I'm also a staff psychologist at UC Berkeley Mental Health.
Thanks so much for joining us. We wanted to at least introduce ourselves. We're now going to turn our cameras off. Okay, well, welcome to this training. What we're trying to do in this training is really help you all think through how you can support each other on campus. And whether you're talking to a friend, whether you're a student leader supporting folks in your group, whether you're in a peer support program or even a GSI, this training is to help you think through how do you support each other and how do you help each other get connected to the resources. Our learning objectives are simple. We want to help you start to think a little bit about your role as a friend, a student leader, a GSI, and understand some of your boundaries, know how to talk to other students, and we're going to do some basics and supporting skills, and then know what the campus resources are. And want to let you know that today we really hope this can be used by many different students on campus. Our focus is going to be a little bit on the undergraduate student experience, but we believe wholeheartedly that if you're a graduate student and you're wanting to support a friend or a colleague, if you're an advisor wanting to support a graduate student, we absolutely think that the information we're providing on how to support each other and the campus resources are going to be very applicable to you, though our examples and the focus is on our undergraduate student population. Hope that makes sense.
Thanks, Aaron. This is Junichi, and I would just like for everyone to just take a moment to reflect on how you're doing, but that quotation question, how are you really doing? There's a lot of stressors that our students are experiencing, but there's also a lot going on in the society right now. So with all the COVID losses, there's also been highlights on systemic oppression, anti-Black racism, anti-Asian hate. And then regionally, also nationally and internationally, there's all kinds of trauma, crises going on, and you hear about all these things on the news all the time. So we and the students are carrying all of these things, right? And then each student might also be experiencing things within the families, things within their personal experience. So when we think about mental health, we want people to be thinking about the holistic wellness and mental health. So just take a moment, think about what is going on for you. Imagine what might be going on for the students that you are working with. And finally, it's really important that we each take care of ourselves so that we can be there for other students. So kind of like what I was just saying before, sometimes we talk about common stressors that students are holding. So we are holding so many things all at once. We're juggling so many balls, and different aspects of your life can really come close to the core of you. You can see the multiple orbits, sometimes issues around our identities, issues around racism, sexism, and other types of oppression might become so salient, and that might start to consume our lives. It might be the basic needs, academic needs, different types of relationship that you might have with friends, family, professor, bosses, right? And then also having to navigate this really large campus and all the resources might be challenging in and of itself. And students have also shared a lot about, or a lot of students have talked about the experience of the imposter phenomenon, feeling like they may not belong. They don't have a sense of belonging here. People might have made a mistake accepting them to Berkeley campus, or they don't see themselves in the campus due to other people seeming to have been coming in with so much more successes, so much more resources, right? Like, I don't feel like I belong. Imposter phenomenon is definitely a common experience that students talk about. So I really like this orbit kind of an analogy of there are multiple stressors that we're all navigating, and sometimes different parts of these life become so stressful. And then all of these things, hopefully you have resources and support to be able to attend to, and the personal resources to be able to attend to all of these things. And when we are under a lot of stress, it's also pretty common to experience these reactions or feelings. So we could have all sorts of feelings like I'm so overwhelmed, I'm so stuck, I'm feeling ashamed, I'm feeling embarrassed, I feel like I should be able to handle everything. So there's all sorts of negative feelings, but also that might start to show in how people are eating, sleeping, daily routine might be changing, they're becoming more socially isolated, or you might be taking more risky impulsive behaviors, and also reduced functioning, not feeling the energy or motivation to do the daily tasks, even the things that they may have been initially interested in, you just don't have that energy to get that work started, or difficulty focusing. So these experiences are common reaction to stress. So in and of itself is not like cause and say, oh, you need to have a therapist, you need to have a counselor, right? It's just that they may need a bit more time to de-stress, time to change their routine a little bit, have more time to connect with their friends and family, change their routine a little bit, right? So then they may just need a little bit of change in the routine, or additional support, or somebody who would just listen, somebody who can listen and understand that maybe that's all they need. At the same time, it's also important to be on the lookout for folks who are really being impacted. So impacting daily and academic functioning, but that is going on for a prolonged period of time, 2 weeks or more. And then those difficulties are showing up in all or multiple areas of their life. So those are more time to intentionally connect those students to more professional support, whether they're academic advisors or residential directors or counselors at CAPS or UHS Mental Health. So I think that's it for me, Aaron.
Okay, thinking a little bit about your role. Remember earlier I said something about you could be someone's friend, you could be a GSI, an undergraduate TA. Being really mindful of knowing your role and knowing the boundaries is really important as you start to support people. And that starts really with, again, that idea of self-care. How do we take care of ourselves? How does the helper take care of ourselves? But know what is expected of you. If you're feeling like one of your friends or one of someone in your class isn't doing well, you can be there to support and validate. You can offer a sense of hope, and you can connect the student to campus resources. And I really want to highlight something Junichi said, is that this training is not about having everyone see a counselor. There's so many campus resources out there that support student wellness, and will have a positive impact on mental health. That yes, by all means, if a student needs to see a counselor, we will let you know how to do that. But we want students to know there's so many different opportunities on our campus to get the supports they're needing. Please be aware you are not a therapist, and you're not expected to do counseling. But your listening and support goes a long way. Think about times when you've had some struggles, and just having someone with an open ear, how impactful that was on you. But also be mindful that you may be, if someone does come talk to you, you may be the first person who learns about a student's challenges. Again, whether it's in the context of your being a friend, or a student leader. And again, we start with self-care and we end with self-care, and that can be a challenge, but it's real important that we take care of ourselves. Doesn't mean that we don't have our own sense of stress, that there aren't times where we feel overwhelmed. But what we want to do is make sure you're taking care of yourselves and thinking through that as a way that you can help other folks. So I want to give you a couple slides on basic helping skills. And there's some really simple techniques and things that you can be thinking about when it comes time to helping someone. So this is our Helping Skills 101 in 2 or 3 slides. And so the first is really just having a sense of empathy, respect, and reality. I used to call this, I would air. My skills were I would air when I was with someone. I would have empathy, respect, and reality. Empathy is experiencing the individual's world as if you were the individual, moving into the individual's frame of reference, understanding what the individual is saying, and communicating it back to them. Sometimes this isn't sympathy. Sympathy is, oh, I feel sorry for you that this is going on. Empathy is trying to understand what someone is experiencing. And sometimes we say it's walking and trying to figure out how to walk in someone else's shoes. And I know that can sometimes be difficult. So sometimes I just say it's traveling with someone, traveling next to someone, and trying to understand their frame of reference. Even if it's something that you haven't experienced. Respect is an attitude of valuing the individual as a human being and believing in their resources and abilities. It's a non-judgmental attitude. So it may be that sometimes you're talking to a friend or another student, and some of the issues that they're dealing with are things that you don't agree with. For the moment when you're helping them, it's okay to disagree with them, but we're going to be in a non-judgmental stance on this. And we're going to believe that they have the resources if we help them think through their challenges to help themselves. And then the reality is kind of two-pronged. Remember that you have a role. You're a friend, you're a GSI, you're a teaching assistant. Know your boundaries. But also the reality is affirming that the other student's experience, and that what they're saying to you is real to them and real, and being able to acknowledge that. With that, active listening is maybe something you've heard before, but is a really important skill. And what active listening is really just tuning out distractions and understanding what a student is saying to you, beginning where they are at, not where you want them to be at. Putting your understanding of the message that they're stating to you into your own words and giving it back to them for verification. You're saying, hey, this is what I'm hearing. Am I hearing it correctly? And delivering that message that is non-evaluative opinion or advice. So really wanting, before you can help someone, you really do have to understand what they're saying. And sometimes I do think we jump too quickly to here's that piece of advice. And so take some time to listen to someone. Three really good skills in this are open-ended questions, paraphrasing, reflecting, and summarizing. So questioning is a really important technique, and you want to ask open-ended questions to encourage talking. So asking someone how they've dealt with a problem in the past, asking someone, what are some of the options that are available to them? That helps to encourage the student to talk. You learn a little more about them in terms of having the ability to help them. Also make sure that your questions are neutral. So you want to stay away from advice giving by way of questions. Have you gone and talked to the professor yet? That might ultimately be something that the student does, but to start with, what are the options that you have? We want neutral questions. Paraphrasing and reflecting is really just saying in your own words what your friend, what your student is saying to you for confirmation. So often the helping process and the supporting process is helping folks hear themselves out loud, hear how others are hearing them. So sometimes when we paraphrase and student says, I'm really frustrated because I did poorly on an exam, so due to the exam, it's been really a challenge for you. And they can say, yeah, that's exactly what I'm saying. Or they may hear that and say, no, actually, what's really going on is I don't know that I should have been admitted to Cal, and that it isn't just that test, it's something else. So by trying to reflect back, to paraphrase back what students are saying, can be really helpful in that process because it gives people a chance to hear what they're saying. And finally, when you're talking to a friend, anyone, summarize what you've been talking about. Hey, we just talked about this really challenging thing that happened in class. These were some of the things that I heard you say. Here are some of the things we came up with in terms of the supports available to you. How does that sound? So that's active listening. It's very quick. I think sometimes both AIR, this empathy, respect, reality, and active listening cognitively are easy to understand. They're harder to practice. So it's okay if you mess up. I know that Junichi and I, there are times where we're talking to students and we paraphrase something and the student says, no, you're not hearing me at all. And I think that's not a failure. That's actually good. That means that it gives the student the opportunity to clarify and for me to get a better sense of what's going on. And you can do that as well as being a support for other students. Hope that makes sense.
Thanks, Aaron. This is Junichi again. So like Aaron was saying before, you don't have to be the therapist. You don't have to be the expert. You're not there to have to fix the issue in the moment, right? If you are the person that hears or notices the student in distress, your role is to connect them directly or maybe indirectly to the resources or the support that would give them what they need. So if you're not sure, definitely consult with your teammates, consult with your supervisor, call CAPS, UHS Mental Health for consultation, or there's always an after hours number. It's 1-855-817-5667 for hours after the mental health, UHS Mental Health business hours after 5 p.m. or over the weekends. That's available 24/7. And again, the best way to help student is to get them connected directly as much as you can to campus support. And then we have a wide range of resources on campus. So this is the student wellness is a campus responsibility. And academic and other issues aside, we have Student Learning Center, get student connected with academic advising through Letters and Science or their specific department. We have residence life staff and supervisors. Educational opportunities programs are great for people who are on first generation or under-resourced background. And there are centers for different cultural groups. So that would be another place to look for or to get connected with students. Financial aid office, basic needs center for food, housing, insecurities. Student organization might also be a great way to get them connected for sense of community, in addition to the recreational sports. And on the mental health and physical wellness side, we have counseling and psychological services. We have primary care clinics with doctors and nurses. We have social services for more specialized services, health coaching, health promotion, and path to care office for survivors of interpersonal relationship violence. And counseling center and path to care are the 100% confidential resources too. So if students are worried about what the university might have to disclose, counseling center and path to care can keep everything confidential. So that would be a great place to connect. For UHS Mental Health, there is bucketed resources. So you could click on the UHS Mental Health or go to University Health Services /mental health. We have specific resources to help you to learn ways to learn more about mental health issues in general, what kind of skills you can practice on your own, and then ways to engage with other students who might have similar experience, and how to talk to someone more professional support. So you can go to exactly what you need or what your students need to connect them with these resources.
So want to just talk for a moment about crisis resources. And, you know, sometimes students will say to us, well, what is a crisis? And I think in this regard, if you're feeling like you need to talk to someone, or if you all are feeling like you need support or advice, we want you to reach out. No student has to make a definition of crisis. We want you to think through, you know, that there are supports for you, and whether you're feeling the impacts of stress or something else, or whether you're supporting someone, we want you to know that you're not alone. And some places that you can call, one is our mental health services. So 510-642-9494. You can call us up and you can say, you know what, something's going on. I really need to talk to somebody. And we will work to get you to talk to somebody. Or you can call that number and say, you know what, I'm worried about a friend. Can I talk to somebody? And we can help you think through how to support your friend or your student or, you know, a colleague in your hall. And then we have our after hours number, 855-817-5667. And so again, that one, if we're closed, you have technically 24/7 access to a counselor to talk to. Now, those services that I just mentioned are UC Berkeley centric services. And we also know that when students are in crisis, that sometimes they don't feel comfortable connecting at the UC Berkeley level. And so we do want you to have a crisis hotline. It's the National Suicide Prevention Hotline, 1-800-273-TALK, which is 8255. And you do not need to be thinking about suicide. Your friend doesn't need to be thinking about suicide to call this number and get some support. And so we want you to have a number off campus if that feels more comfortable to you. But understand that those numbers, the 642-9494 and the after hours number are connected to UC Berkeley, where we're able to connect you to the things on our campus if something is going on.
Thank you so much for hanging in with us. So this is our last slide. We just want you to take just a few moments to think about, okay, what are some of your few takeaways? What did you learn something new? What were you reminded of from our slide and talk today? Is it that we think about different types of stressors that we might be facing, different ways to support your student, active listening, the ERA skills Aaron talked about, or maybe range of campus resources. Whatever it might be, we hope that you took something away from our videos today, and then we will probably make the slide available for you on the website so you can click on some of the resources and then connect with more resources or learn more about these resources. And please give us a feedback at the link that will be provided on the slide. And thank you very much for tuning in.
Thank you so much, everybody. Thanks, Junichi.
Thank you, Aaron. Take care, everyone.